Welcome to another episode of Upper Limb Anatomy. Today, we're exploring a small but clinically significant region of the posterior axilla, the quadrangular space. We'll cover its anatomical boundaries, its contents, and a condition known as quadrangular space syndrome. What is the quadrangular space? The quadrangular space is a small anatomical area located at the back of the shoulder, within the posterior part of the axilla. It acts as a conduit, allowing important structures to pass from the axilla into the posterior compartment of the arm. The quadrangular space is bordered by four anatomical landmarks. Superiorly, by the inferior margin of teres minor; inferiorly, by the superior margin of teres major; medially, by the long head of the triceps brachii; and laterally, by the surgical neck of the humerus. These boundaries form a rectangular window through which vital structures pass. Here's a 3D view to help orient you with the surrounding muscles. Remember, the subscapularis lies anterior to this view and isn't visible from the back. The contents of this space are two crucial structures: the axillary nerve, which innervates the deltoid and teres minor muscles, and the posterior circumflex humeral artery, which supplies blood to the shoulder region. Both travel through the quadrangular space into the posterior compartment of the arm. Quadrangular space syndrome occurs when the axillary nerve and the posterior circumflex humeral artery are compressed within the space. This can be due to muscle hypertrophy, especially in athletes, or fibrotic bands that form between muscles. Clinically, patients may present with pain over the lateral shoulder, numbness or tingling in the axillary nerve distribution, and pain during abduction or external rotation of the shoulder. This condition is often misdiagnosed as rotator cuff pathology. To recap, the quadrangular space has four clear boundaries and transmits the axillary nerve and posterior circumflex humeral artery. Compression here leads to quadrangular space syndrome, a diagnosis to consider in patients with shoulder pain and neural symptoms.